Hello, my name is Sarah Hyde, and I'm going to be presenting our project on the use of budesonide with surfactant in very low birth weight infants and its potential impact on bronchopulmonary dysplasia outcomes in the NICU. So, bronchopulmonary dysplasia is a major cause of morbidity in very low birth weight infants. These premature infants usually require some form of respiratory support, and inflammation in the developing lungs can contribute to impaired lung development and long-term respiratory complications. Budesonide is a corticosteroid that can reduce this inflammation, and when administered directly with surfactant, it may provide a more targeted anti-inflammatory effect while potentially limiting systemic side effects. The purpose of this project was to evaluate whether standardizing the use of budesonide with surfactant in the NICU could improve respiratory outcomes in very low birth weight infants and potentially decrease the incidence and severity of BPD. So, in October 2019, our institution implemented a clinical guideline incorporating budesonide administration with surfactant for eligible very low birth weight infants in our NICU. And to evaluate the impact of this practice change, we are conducting a retrospective chart review of infants weighing less than 1,500 grams. We are comparing outcomes from the pre-implementation cohort, which received surfactant alone, to the post-implementation cohort, which received surfactant combined with budesonide. Our outcomes of interest include the incidence and severity of bronchopulmonary dysplasia, as well as any potential adverse events associated with the budesonide administration. So, further analysis will compare BPD incidence and severity between the pre-implementation and post-implementation groups to determine whether the addition of budesonide may improve the respiratory outcomes. Secondary analysis will also evaluate any potential budesonide-associated adverse events. So, budesonide administered with surfactant may help reduce pulmonary inflammation in premature infants and may represent a good strategy for improving respiratory outcomes in these very low birth weight infants. Standardizing the use of budesonide in the NICU may also support a more consistent respiratory management. So, findings from the post implementation cohort may help inform future institutional treatment protocols, and if shown to be effective and safe for this population, budesonide administered with surfactant could provide a more targeted approach that may improve outcomes while minimizing the risks associated with more systemic corticosteroids. Ultimately, this project contributes to ongoing efforts to optimize respiratory care for premature infants in the NICU.